Our community is at higher risk of getting sick and die.
Have a conversation with your healthcare provider. They can answer all of your concerns. There's been a lot of misinformation passed around.
I lost 3 people that were very dear to me in 2020, so without hesitation, I had no problem getting the vaccine.
For someone who's a little apprehensive about getting the COVID shot, I would say talk to your doctor.
I would encourage everybody to get it.
Let's stop ourselves from dying. Let's get the vaccine. 2020 was really stressful. My physical and mental health, I was in eternal fear about getting the virus, getting sick, or even maybe dying from it. I also got the vaccine for my patients because I wanted to reassure them that it was safe and effective, and I wasn't asking them to do something that I wouldn't do myself. And I also wanted to be part of the solution. The more people that get vaccinated, the closer we are to beating this virus. So I did it so that I could help us get closer to normalcy. And finally, I took the vaccine for my children who lost their father to COVID-19. I wanted to make sure that they know I'm doing everything I can so they don't lose another parent to this awful disease. So get the COVID vaccine. It is safe, effective, and it can help us get back to the things we love to do, hanging out with our friends and family, and also help us be part of the solution. So let's talk about the vaccines a little bit, because I know a lot of people out there don't want it. They're worried about how fast it came out. They're worried about the side effects. Research literally stopped for so many other things so that everybody could focus on getting a vaccine to save essentially the continent, to save us all. Everything just moved at a super fast pace, not because they cut corners, but because they didn't waste time. So we have 3 vaccines. And actually, I think the fact that the Johnson & Johnson was pooled should actually reassure us that we are not being complacent. We are actually checking all the time to make sure this is safe. And if it's not safe, it's going to be pooled. So the vaccines are safe, they're effective, they prevent you from dying from COVID-19. Side effects, it's true. But most of these side effects last for about 2 days. 2 days of mild side effects versus getting COVID-19, landing in the hospital in the ICU and potentially dying. I think 2 days of mild side effects is worth it. So I know that some minorities, African Americans, Hispanics, are suspicious of this virus, and rightly so, because historically the medical field has done things that are harmful to the community. We know the data. COVID-19 has killed and impacted minority populations disproportionately. So we are dying more, we are getting sick more, we're losing our loved ones more. And now we have a way out, and we're saying, no. What are we doing? We are selecting ourselves to do worse. If over 200 million Americans have gotten this vaccine, it should tell you something, that it's working and it's safe. So please, 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 don't listen to the hype. Let's take care of ourselves. Let's stop ourselves from dying. Let's get the vaccine.
I got the COVID shot because I want to keep my family, friends, and those that I come in contact with safe.
I did get the COVID vaccine. I got both doses. For me, it was more so a personal issue. Been diabetic for 30 years, and I knew it was really important for my health as a diabetic and being diabetic for so long to remain healthy.
I did get the COVID-19 vaccine. I did it so I could do my part in helping to eliminate the pandemic as quickly as possible, and we're all in this together.
It was also important for me to protect my family.
Don't hesitate. It's a good thing. Get the shots.
So let's talk about the vaccines a little bit, because I know a lot of people out there don't want it. They're worried about how fast it came out. They're worried about the side effects.
I got the COVID vaccine. I actually got the first dose when I was pregnant. I was 36 weeks pregnant during my first dose, and then my baby came at 38 weeks, so I got my second dose after she was born. So I got the vaccine. Really, I wanted to give the most protection to her as I could. So I definitely talked to my doctor before getting the COVID vaccine when I was pregnant. I would recommend pregnant or not pregnant, talk to your doctor if you have any hesitation about it. They've been keeping up on the science, and so they know what's really recommended by the CDC.